The face of primary care in your area could be in for a change as 64 clinical commissioning groups across the country have been given more responsibility over their GP services. Sandwell and West Birmingham CCG are reviewing local GP services with the intention to invest £20 million. If agreed, it'll be the group's single biggest investment into primary care.
Well, it's a huge investment. It should have a massive impact. We spend about £70 million a year on primary care services in this area. We serve over 500,000 people, so it's a large patch. And this investment will make a very big difference, both to the number and range of services available and also to the access that people have to them. I think people will see the difference in terms of the hours that they can access primary care, so more services on the weekends, more services on the evenings, but they'll also find a range of services that they currently can't get in primary care, or at least not always get, so more diagnostic services, more screening services, more emphasis on health promotion and on immunisation and vaccination, for example, as well as some services like near-patient testing that at the moment they might have to go to hospital for. So for some people it'll make a really big difference.
And the group recognised the importance of listening to the views of the local community to identify if any improvements can be made.
We've run a couple of public events just recently, but we've also been talking to people over quite a long period of time actually. We've had great feedback. We always get very good engagement with people locally. The key messages we're getting is that they're very supportive of this. I think they want to see primary care services developed and improved. People are particularly concerned to see that they get better access. I think that's a theme that regularly comes up. But people also want help to try and stay well and stay healthy and to continue to live independently. So we've had some really positive feedback to the proposals that we're making.
And it's all part of a wider 5-year strategy.
We've been working for some time to try and make sure that people locally can get more care closer to home. And we've worked for a number of years on developing hospital services. This is our chance now really to get the primary care services right. So on top of the money we're already spending, we're going to put this big investment in the hope that we can make primary care services much more accessible to people locally.
The CCG will continue to work with GPs on the proposals, ready for when the scheme goes live on the 1st of April next year. Lois Swinnerton for the Midland in West Bromwich.